want to bring you a medical alert about a very popular antibiotic, Z-Pak. The FDA says the drug could lead to sudden death for some people who have certain heart conditions. Which ones? ABC's chief medical editor, Dr. Richard Besser, tells us more about the medicine and when to be concerned.
It's prescribed nearly 60 million times a year to treat common infections: ear, nose, throat, and chest. So popular, people ask for it by name. Do you ever have a patient come in with a cold or flu who says, "Doc, give me a Z-Pak"?
We have that all the time.
All the time?
All the time.
But today, that warning from the FDA, for some patients, Z-Pak, also known as Zithromax or azithromycin, can cause abnormal changes in the electrical activity of the heart, which can be fatal. The warning applies mainly to people with rare heart problems called arrhythmias, and people with low blood levels of potassium and magnesium. For these people, the risk of sudden death is roughly 1 in 4,000. Tonight, Pfizer, the Z-Pak manufacturer, tells ABC News they're updating their labels with that FDA warning, listing those conditions. But many patients may not even know they have those conditions. And all too often, people ask for Z-Pak when they start to feel sick. Have you ever asked for Z-Pak?
Oh, yes.
I've asked for Z-Pak.
You asked for Z-Pak?
Reputation.
What's its reputation?
But it knocks it out.
That fast?
Yes.
Yeah. Z-Pak is safe for most people. But to reduce your risk, know your family's heart history and your own. But the best advice? Don't request antibiotics. They only work for some infections.
We want to be the heroes. We want to make people happy. We want to make people feel better.
But remember, antibiotics won't make you feel better if you only have a cold or the flu. Dr. Richard Besser, ABC News, New York.